Now waiting we do Pan the television, me say them talk about we. Pan the radio, me say them talk about we. Pan the newspaper, self them write about we. They no write nothing better, so bad thing about we. Now waiting we do. Now waiting we do Reverend don't pray tete, situation not change. Alpha don't pray tete, situation not change. Oh, then do we? Mercy. Now waiting we do Now waiting we do Pan the radio, me say them talk about we. Pan the television, me say them talk about we. Even the newspaper self them write about we. They no write nothing better, so bad thing about we. We come on a salon. We come na England. We don't run away. We come for better. We people that want for see what till we they do. We people that want for know what till we they say. Oh, we let me alone.
Good afternoon, everybody. Good afternoon. Just to keep you updated, we can't talk about this COVID-19. We know they talk about the actual virus itself, but they can't talk about how we they look after we as a community. For those of you who don't know me, Mina Aisita Sise Jalo of the Health Show. Usually watched on live on Diaspora Voices. So my brothers and sisters, mama, papa, them, I just want to appeal to each and every one of us. It's very, very important. We pay attention to waiting to go on now we country as a whole and all over the world as a whole, because sometimes we always believe something not happen to we, not to the next person it happen, and that not to just we in terms of this race, the black race. It can happen to white people themselves as well. All man, this world, all man feel say the next bad thing they happen to the other person, not to them. So today we can't talk about just COVID-19 a little bit, just coronavirus. Me not to a specialist, however, I've studied a bit of tropical medicine and infectious diseases, and more so it's just my role in the community, the role I choose to become in the community, which I feel say na me own part where I go play now this we wonderful and amazing community within we Sierra Leone brothers and sisters, especially in the United Kingdom now. Yeah. So just to give an update, from yesterday, the 16th of March, this virus here, we all know, coronavirus, is a virus at the moment where not get any treatment or cure. It comes from the same family as the SARS virus, and there's still a battle how we then go sort them out, how we go contain them, and how we go keep her under control. We all know say come on that we country so they go buy but cool things, and these days when are one of the top business country then are the world now, the leading business country, China, and it don't trickle down, don't kill a lot of people, and they don't infect a lot of people, but at the same time a lot of people will not die where they get treated with the symptoms until it don't trickle in way through. It don't go America, it don't come the whole of most of Europe, it don't come between this England here as well. So waiting me and you go do about it, considering as the day goes by, every day with the yearly changes, with the yearly updates from the government and all the infectious disease team and Public Health England and NHS England and so on and so forth. What you go do about it? So underlying illness, by that they mean either you get asthma, serious asthma, either you get other respiratory problem, them breathing problems, them, or you get diabetes, or you get heart problem, or you get kidney problem, or you get cancer, especially lung cancer, or they take medication where they suppress your immune system. For example, some sickness and such as like lupus, SLE, and even HIV. You get some treatment there where they make they suppress your immune system, because your immune system they overwork for some of their illness there that make that they try for suppressor. So which is okay for you when they keep you going, but at times like this it puts you more at risk. So you got to be mindful of that and think about that carefully. So now then people then they at risk. The risk group, now then people then they, and also the vulnerable young picking them way unwell. Not only well picking them, the one that way young way themselves get underlying illnesses, like people that way they suffer from cystic fibrosis, then chronic lung diseases and so on and so forth. Themselves also they at risk. So that is what we're going to focus on today. So some of the symptoms, the most common symptom what you look out for. Now that new persistent cough. Not to you will get smokers cough, not to you will get cough because you get respiratory problems already. Not to you where we get chest infection 2 weeks ago. This now that new cough where you they notice. Then it persistent. Then you they feel hot and fluffy and clammy. Or you might not feel hot at all. So it better, I go advise everybody, if you haven't already, try for get a thermometer now you host, where they take your temperature, or you and your family on a temperature. Because it's very important where you call for advice to any of the helplines. Now some of them question and they then go ask you. So think about that, and that's very important. So those are the two most common symptoms. And the incubation time, which is basically from the time where you don't get the virus to the time where they begin manifest some of them symptoms there, can take up to 5 days. So that is why they're going on about what you should be doing, what you shouldn't be doing, cleaning, social distances, so on and so forth. So please, let's think about that and move on and go on and so forth. Okay, so in the United Kingdom, if you're on your own and you notice the symptoms there, you for self-isolate for 7 days. If you're not on your own, as in you get man, you get pikin, you lodge na house, una all rent one room, na house, and so as long as not you one grain they live, well, one of una gets them symptoms there, una all for be isolated, una for action self-isolation straight away, and then una then na house for 14 days, which is very, very important, because for try and see how best we can reduce the peak of this virus infecting new people, which is really what the government they try for do. That they hope say with all these restrictions in place, hopefully this go prevent the rapid doubling of this infection, because now from one day to another about 200 or more people that they get infected. So that they try for reduce that peak there, but also their isolation they are go help especially the vulnerable group them, such as the elderly, we already get underlying illness. Them, the reason why make it go help them, it not go just only help them, it go help the mortality rate as well. Mortality rate basically means the death rate, because that the more they're at risk. So that is why they're talking about all these self-isolation. Now, the reason why I bring this up today is because we get for think the government not begin say hint, the elderly 70 and above, where now they're the most vulnerable, that they consider for quarantining for 12 weeks. So we as a community, what we go do for we elderly people, where then at this we community, waiting we they think for we elderly people, where they live on their own. What are we thinking about them? As a community, I want for encourage make we put together a response team for the elderly there. A response team will go provide support in various ways through multiple media outlets that we community able access. Through other ways such as providing food for them people there. So me, I plead on anybody, healthcare professionals, community activists, with local celebrities, religious personalities, young activists, the active Sierra Leonean communities across the United Kingdom, as in then other towns like Brighton, Birmingham, Manchester, Coventry, Reading, Leeds, Scotland, and Wales. Una check. I don't need for Biboku. I don't need too many people. I need just about 12 people. And them 12 people that they want need. Now people that will get a full driving license, we're able to drive. The reason why, because if we need for provide food for them people there, we go create a shift pattern where we go able, some people when not they work morning time, go drive, go deliver them food there. Some people where they go work evening time, go drive, go deliver them food there. And that could be, non-perishable provisions, or just even a hot meal for we mama and papa them, and we granny them and grandpa them, and we auntie and uncle them, we might be living on their own. We not get no family. Where then dependent on that then weekly pension whether they get or whatever little benefit for let them draw that and trolley, then go shopping. They might be okay the first 1 week. They might be okay the second week. But what happens when they start running out of milk? What happens when they start running out of rice? What happens when they start running out of so on and so forth? What would happen to them? So now them people then I want we create a response team for, so we go support them people then they do ya, my brothers and sisters. So we are looking for the elderly 65 and above, where they live on their own. We also look for the elderly where 65 and above, they might not be living on their own. They might be unwell. They might have somebody with them as a carer who is a bit restricted. You know, go able for they come up for go buy things them. Because he's afraid for go make it go expose himself, make it not come pass and give in person. So please, let us set up this rapid response unit for we Sierra Leone community. I live in Sodok, so we're gonna base it in Sodok. Why? Because Sodok has the largest population of Sierra Leoneans in the United Kingdom and Ireland. So that is why we're gonna base it there. So I want 12 people who have a full driving license to join me for this delivery. So all you other people, what I'm expecting of you is for check you with your friend or your family, for make sure say if you know of anybody, any of the elderly will fit one of these criteria. I'll repeat it: 65 and above, living on their own, or 65 and above, living on their own as couples, but they're also, 65 and above, living with a carer, where because that 65 and above not well. And then the other group of people, what would they look at? Is people with children who are vulnerable. When I mean vulnerable children, people picking them will get some sort of illness, long-term illness or chronic illness or disabilities, where then them parents, now their main carer, they might also get stuck. Because we know, say, if you're a single parent and you have these children, then you maybe carers then go stop for camp, because a lot of people go get carers where go can help them so that then go get a bit of respite. But the way things are going, some people will stop working. So everything is going to be minimal. So please, 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 I'm begging you, I'm asking you. I have a garage, so storage is not a problem. DJ Little has a garage, so storage is not a problem. We're not asking for much. Even if now 1 baked beans, it go be fine. I'm going to speak to different people now, community, where get stations or areas where people they go, where they can go drop something there if they can, So please, if nothing the way they expire very quickly, like in the next 3 months, I will go donate them back na food bank na this country. If na things then when they expire for a while, let's say about 12 months, I they put them na box, I ship them, I go give people them na salon where need them. So it's going to be a win-win situation. And my sister Auntie Harriet, oh sorry Auntie Harriet, I forget you self get garage. My sister Auntie Harriet self get garage. So do ya, me brothers and sisters, let us think about this carefully. Let us try and be selfless. Let us think sensibly with a level head. So my brothers and sisters, let us think about that. Let we think about we own role within this infectious disease where they go on. Let we think about it. How we go help as a community. The government already begin tell we today about social distancing. Let us start practicing social distances. We community, a lot of people have done well already. They'd already canceled events as far as April. Let us encourage people to cancel events. It is not the end of the world, because Uda in right mind, actually, they go any event this hour, whether they say minimize 10 and less in terms of groups. Uda in right mind. So please, please, please think about it. But we have to be mindful. We get for be vigilant. We get for practice. We get for practice the simple things. Like if you cough, you sneeze, try for cough and sneeze now a tissue, or you close like this, or that's, or, And when you done, go wash your hand as soon as possible. If you don't get soap and water with soap and hot water, if you don't get them, then use hand sanitizer. But the primary practice is soap and water. Make sure so you rub the soap on your hand, you rub your hand, you rub your hand like this, you rub your hand, you rub your hand for good 20 seconds. Good 20 seconds, you rub your hand. So the whole process, by the time you done, it takes you about 40 to 60 seconds, for do that hand washing day. But make sure, say why? Because this virus in your skin layer, not that strong. And soap they break down fairly quickly. So if we do that, it will help. Then if you say you dey cough, you dey sneeze, no go outside you company and day. Please, no go there. It is not fair on others. Think about yourself, but also always put other people first. Okay? And then by the way will they try for reduce the spread of this germs here is regular cleaning. Do regular cleaning. I be they listen to a virologist, somebody who study virus basically. When I work no more for study how virus then they behave, how they survive, waiting they make them tick, waiting on they make them tick. I be they listen to him. He say this particular coronavirus, there's an average survival rate outside we the host now about 9 days. And even that if you're on a cardboard surface, if you're on a wood wooden surface like you dining table, you sideboard or you TV unit, if na wood, they survive for about 5 days. On a glass surface, it survive for about 3 days. So please, regular cleaning is very important, especially areas them where they touch and use a lot. Now we house them. Wash your hands. Do things, I know say some people go say, me ambulance wash me, I'm waiting at the say. No, do it more often now. Where you cannot also, you wash your hand. If you sneeze, you cough, wash your hand. So please, 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 my brothers and sisters, let us think about all these things. And this is not just about me. It's about all of us in our community. Let us create a focus group, a rapid response group for we elderly and the vulnerable. We might be able to survive 1 week or so, but after that, they might not be able to survive because they would have run out of food. They go all local. We get a lot of local sisters and brothers them we get shop. I already don't start today na East Street. I will continue on Thursday. I will go na all the different local store that we owned by we Sierra Leonean brothers and sisters and go put the word before them. So if they say okay, if they're able to give something where we need them, then fine. If they don't mind, let people then go drop things into them. That's fine as well. So every little counts, every little makes a difference. Look after yourself and remember, hand washing is the key, and try and practice social distancing. God bless you, and I love you all. Thank you very much for listening to myself, Mrs. Isata Sisejalo, from the Health Show Partnership Program. Usually live on Diaspora Voices. Thank you and God bless you.
Now waiting we do it. Now waiting we do.